Alors bonjour à tous, bienvenue.
Hello, everyone, and welcome to this press conference to go over the situation in Quebec as far as COVID-19 is concerned. The Deputy Premier of Quebec and Minister of Public Safety of Quebec, Ms. Geneviève Guilbault, is together with the Minister of Health and Social Services, Ms. Danielle McCann, as well as the National Director of Public Health, Dr. Horatio Ruda. Madam Deputy Premier. Thank you very much, Mr. Gagnon. Hello, everyone. So, as you perhaps already know these days, this week, in fact, we are mentioning the National Week of Mental Health, which gives us the opportunity to talk of mental health, which is a very important subject. With the pandemic, we've talked a lot about physical health, and we've worried a lot about it. And justly so, but we do have to talk about mental health. That is important. And this fight that we are waging against COVID-19 to preserve the physical health must not be done, of course, at the detriment of mental health. So we shouldn't have to choose between the virus and distress, but we, of course, have to fight and wage a war against both at once. So today we're going to announce the setup of a COVID-19 action plan for mental health, which will come together with new investments of $31 million for mental health. This plan that my colleague, Minister for Health and Social Services, will be talking to you about it a bit further in a few moments. And I would like to take this opportunity to address myself to all those people who are dealing with issues relating to mental health. Do not hesitate to consult, to ask for help. It's very important. It is just as important as physical health. So with this plan, of which my colleague will be talking to you, we are giving ourselves new means to help people with their mental health. So do not hesitate in asking for help. We are there for you. I will now go on with the day's numbers. So we have 112 new deaths today, for a total of 2,510 deaths. Of course, our condolences and thoughts are with the families of those people who have died. We now have 34,327 confirmed cases, an increase of 910. And 1,840 people who are hospitalized, that is an increase of 19, and 213 people in ICU, that is a decrease of 5 people. I would like to come back to the gradual reopening of schools and daycare centers as of next week. First, just to say that it is obvious that we won't be able to open daycares in the same way as before COVID-19, at 100% of their capacity from one day to the next. There, just as everywhere else, we'll have to go progressively. So next week, we will be in a first phase of 30% of the capacity, and afterward, as I said, we will be going progressively for the rest of the reopening. We're very conscious of the fact that it can complicate things for some parents, complicate the organization for certain parents, but we have to remember that we are faced with an exceptional situation that brings about exceptional circumstances and certain inconveniences. That's obvious. So we ask the parents for their understanding, and we thank them for being understanding with regard to the fact that they will have to have this extra logistical issue, at least for the beginning of the progressive reopening of daycare centers. We'll also have to adapt ourselves in our primary schools, because there we will also have a logistical issue for professors, for schools, for parents. We said that there will be a maximum of 15 students per class in primary schools when we reopen. So assuredly, that is a logistical issue as well. But we're asking everybody to place themselves in solution mode. If we all help out, if we're all show solidarity and find solutions, and we're all focused towards the success of our reopening objective of gradually reopening the schools and all of those sectors of activities of Quebec, we will get there all together. So let's all place ourselves in solution mode, and let's be indulgent and understanding for the small difficulties logistics-wise that will have to be surmounted at first. We know that many teachers as well, many educators are worried for their health, and that is understandable. It's normal to be stressed out. It's normal to be concerned. It's normal to have questions with everything that we've been experiencing for the past few weeks, everything that we've heard and read and seen. It's understandable that people may have worries. That is the reason why we wanted to clear up the information as far as the risk factors for health associated with age. So public health has established the risk factor at 70 years of age, not at 60, which makes it that as of 70 years of age, the possibility of developing complications and the risk of developing those complications is much more significant as of 70 years of age. Below 70 years of age, people can go back to work without significant risk to their health, with the condition, of course, and this is important to mention it and to remember, with the condition of respecting the guidelines given by public health, for example, social distancing, hygiene. So we also ask all employers of Quebec to take that into account, to be conscious of that, to make sure that those guidelines can be respected in all physical work environments where people will gradually start going back. So it will be possible for educators and professors and teachers aged between 60 and 69 years of age to go back to work as of next week. As I said, it is as long as the public health conditions and guidelines are respected, and not only for grown-ups, for children as well, since we are talking about teachers and daycare centers. So there will be children in school and daycares as of next week. So I'm launching out a call to all parents to already start explaining to the children the new way that we're going to have to behave at daycare, at school from now on. Of course, for them, it's going to be entirely new. We're not going to behave exactly the same way that we used to before interrupting the services before COVID. So it will be important to keep our distances, to wash our hands very often, to cough into our elbow if we feel like coughing. So I'm counting on parents. We are counting on parents to do that preparatory work and to create awareness in our children. And by explaining to them and repeating them, I'm very confident that our children are going to understand the guidelines and will be able to apply them, which will help everybody to be able to proceed to this gradual reopening in all safety. I also wish to say a word on the detention centers. You know, I, as Minister for Public Safety, I have under my responsibility our provincial detention centers. And therefore, I am keeping a very close eye on the situation in our detention establishments. And I have been doing so since the beginning of the pandemic, and particularly in the Montreal Detention Center, which people know under the name of Bordeaux, where there are a certain number of prisoners who have tested positive to COVID-19. So obviously, like everywhere in the world, our incarceration system is facing a very important challenge with the pandemic. Since the beginning, it is a closed housing facility. So, of course, there are risks of contagion. There are people there who are more at risk than others. So there is a situation that we had to keep an eye on and that we are keeping an eye on and have been since the beginning. And since the beginning of the pandemic, we set up preventive measures in all of our detention centers. Of course, there's social distancing, hygiene, and all that have been set up in all detention centers. There's also been the suspension of visits. There's a lot of activities that take place in visio, conferences and things with the justice system as well that adapted itself. So many measures were set up, and we are adding today the fact that we will be granting. So it's the directors of those establishments who will proceed to this, but certain permissions to leave will be allowed for medical purposes to certain very targeted groups of detainees who have less than 30 days left in their sentence. And I want to reassure everyone that the people who will be able to use that permission to leave for medical purposes are people who will have committed very low-level risk crimes, and no detainee that has committed any violent crime will be coming out of the detention center. I want that to be very clear. We're talking about very, very targeted factors, vulnerable people, for example, pregnant women, and people who have less than 30 days left of their sentence, and all those who have committed serious offenses, violent offenses, crimes against other people will not be able to leave the detention establishments. I want that to remain very clear. But since we are facing this pandemic in the detention facilities, like everywhere else, we have to set up the measures to protect our staff. We do have a responsibility towards our workers. The men and women who work in detention centers must be protected as well, like anybody else, like any other worker. And those permissions to be able to leave for medical purposes are not special measures that we created for COVID-19. These are measures that already exist on the Act for Correctional Services, just that we are adapting this notion to the exceptional situation that we have been experiencing since the beginning of the pandemic. And as well, it is a measure that is applied elsewhere. We've been looking at what's been done elsewhere, the best practices globally in the management of this pandemic, but also in public safety. And that notion of granting permission to leave for medical purposes has been implemented in other places, for example, in Ontario, in British Columbia, and also in Manitoba. So we will go along with this as well, still with that willingness and that worry of protecting our staff from the Correctional Services Network. Now, for my daily thanks, I would like to thank once again the correctional services workers. Since we're talking about this, they do work that is very often unseen and invisible, but that is very important. They're also at the front lines. Thank you very much for the work that you're doing. And I also wish to thank our municipal elected officers who are as well frontline workers in a different way. So, they are very close to people. They are very important allies and have been since the beginning. They took part in many of the meetings with many of the mayors, the prefects, who relay very important information and who also work 7 days out of 7 since the beginning in order to help our citizens. So thank you. They collaborate so well. They also collaborate with public health. So it's a pleasure to be able to work with them. So thank you to all of our elected officials, municipal and others. So we need you as well to help our citizens who, of course, have many questions, understandably so, and who expect that the elected officers be able to answer them. And I would like to end by saying that despite all of our concerns and maybe the obstacles and hurdles and the questions that come together with a gradual deconfinement of Quebec, it'll be good for us to be able to experience that gradual deconfinement, to be able to slowly go back to a little bit more of a normal life throughout these first stages of gradual deconfinement. And if we wish to continue going forward towards that return to normal, and I want to put normal in quotation marks because for many months it's not going to be the same normal as the one that we had before the pandemic, but to go forward slowly towards that return to normal, we have to continue respecting the guidelines of public health. We'll never say it enough. Continue remaining at a distance from others, avoid gathering, wash your hands, and respect all of the guidelines. We have to continue protecting our vulnerable people, and in that way, we will get there all together, and we will be able to find a life that is a bit more normal, if I dare actually use that word, eventually. So thank you, everyone, and courage for everything else. Did you wish to say a few words in English? Yes.
Good afternoon. I want to come back to the gradual reopening of schools and daycare centers. First, daycares will open at 30% of their capacity next week, then it will gradually increase. We will also have to adapt in elementary schools. There will be a maximum of 15 students per class. We know that this is a complicated situation for parents, educators, for teachers, but we are facing an exceptional situation. We ask you to be understanding, and we thank you to be understanding. We also know that several teachers and educators are worried about their health. This is why we wanted to clarify the situation regarding the health risks associated with age. Public health authorities tell us that before the age of 70, it is possible to return to work without significant risk. All Quebec employers are asked to take this into account. I also want to say a word about the situation in jails. We're taking the situation very seriously, and we are doing everything we can to protect correctional officers as well as inmates. So we must continue all our efforts and keep up the physical distancing. This is how we will win this battle. Thank you.
And I would like to hand the mic to my colleague, Minister for Health and Social Services. Thank you, Madam Deputy Premier, Dr. Ruda. Hello to everyone. So Quebecers are facing an unprecedented situation because of the COVID-19 pandemic. This crisis has major impacts on the physical health of our population, but on its mental health as well. And we can't make the error of neglecting one while treating the other. Mental and physical health go together. So since the beginning of the pandemic, 15% of people have reported experiencing distress that is 7 times higher than before this health crisis. We have a lot of elderly that are experiencing isolation, a lot of essential workers going through anxiety, and a lot of families whose lives has been completely turned upside down. Unfortunately, the situation may worsen and prolonging itself over the next few weeks and even the next few months. Literature and the state of knowledge on the impacts of confinement are very clear. The summit of the curve for psychological distress happens many weeks after that of the pandemic. We must therefore, as of now, deploy efforts to flatten that curve as well. We are therefore talking about a curve in terms of mental health problems. I'm therefore announcing today an investment of $31 million for the setup of our action plan COVID-19 in psychosocial services and in mental health. Concretely, the investments are going to allow deploying more resources in order to improve and intensify the service offering in the psychosocial domain as well as mental health for anybody who requests it. That includes hiring professionals who usually practice in the private sector, and that also involves improving the telephone services Psychosocial 811. There are other measures as well that are already ongoing. There is the special program to support families going through mourning, which includes individual consultations and a hotline service. There's a telephone blitz that has allowed joining close to 800,000 people who are being followed or waiting for services, and the Aller Mieux campaign has been deployed on different media. And finally, a guide published for those populations is ongoing. All of these measures have the same purpose, taking care of the people who need it. So I want to say to all those who are experiencing mental health problems, do not hesitate. Ask for help. We will be there for you, and we will be there to support you. And I would like to end by thanking all those people who work in mental health or in psychosocial services with the most vulnerable amongst us. Your work is truly essential. Thank you. Thank you. So if you're ready for questions now, we will start with the French questions. Dr. Arruda, last Monday you announced the postponement of the opening of businesses in Montreal for the 18th of May, but we know that the situation in Montreal remains difficult. Mr. Legault was mentioning this week that the leeway is fairly small in the Montreal Health Network. In that context, less than 2 weeks away, is there another scenario being considered to delay the opening of schools in the Montreal region, and what factors are going to be the ones to help you determine that decision? Well, listen, all scenarios are being analyzed. No decision has been made, so don't expect me to make any announcements today. But what is being considered, the criteria together with, what is the level of transmission and control. So we're also looking at what is happening in CHSLDs compared to the population and the zones that have already reopened as such. The capacity for the teams of public health to be able to control the screening data that will be taken into account. So it's all those factors that will be looked at. But the situation remains a situation that is worrisome. In terms of care capacity, there is leeway. If you allow me to say so, certain people are still being hospitalized who don't need to be hospitalized. So we have to bring them to other places. In terms, the level of hospitalization remains stable, but part of those people shouldn't be at the hospital. In terms of ICU, that remains stable. There's still leeway there as well, but we are going to be reevaluating the data throughout this week, and I have the impression that our authorities will have to make a decision in order to be also able to give people the time to get ready. But if ever it does get postponed, we will still maintain the work that is necessary as such. And the other element that I also wish to mention, and that is a very important one, is that beyond the deconfinement that we'll be doing in these areas in terms of businesses, of different kinds of groups, it's important that people understand that if we add to that the total deconfinement of individuals and that people start going shopping intensively and that they don't respect the 2-meter distance, that they gather, that they get together, well, then we're introducing introducing a new danger element that could increase the R0 significantly in Montreal and what we call the proportion of individuals that respects social distancing. So all of that will be analyzed, but we'll also be giving very clear guidelines. If we close things down or we postpone reopenings, it's also going to be important that people, because, spring is here, warmth is coming, people feel like going out, but if we do go out all at once, all that we've acquired through the social distancing in the past is going to make us go back. And in a very densely area like Montreal, when it's hot, it's dense, there's a lot of contracts and a lot of activity sectors, it's not going to be good. Thank you. You said in the past that we probably got to the peak of cases back in April, but when we look at the graph, we see kind of like this long plateau. So we're wondering, do you still consider that we did reach the peak? And if so, when can we hope seeing the curve go back down? Or should we get used to living with about 100 new cases a day and about 100 deaths, unfortunately? Well, we have to understand that we have 3 or 4 epidemics in Quebec so that the peaks can, go one on top of the other. We had reached the peak in the community of Montreal around the 4th of April before we call the CHSLD phenomena, which came and changed and, went on top of that. So we have a first wave that is associated and people probably associated to travel, and then there were breakdowns. Right now we can even look at the history of the epidemics from one region to the other that didn't have the same factors. And after that, there was the traveling, which brought in certain cases outbreaks, the health workers. Now the health workers are, going back into their own families. So that is what brings about this kind of plateau. But I do have very good hopes that if we maintain the social distancing measures and if we reopen and we don't see things go back up and maybe we'll see them go down as far as hospitalization rates, it's clear that the external profile outside of the Montreal area is very low in the sense that, whether it be a pessimistic or optimistic scenario, if we maintain that social distancing, it will go very well. The issue is in the metropolitan area.
Bonjour à vous trois.
Considering, Madame Guilbault, the present numbers and the difficulties that we are experiencing, are you still comfortable with the decision of starting to reopen the schools as of the 11th of May, knowing that in Quebec we are the only state throughout North America to open primary schools so early, if we compare ourselves to the 50 U.S. states and the 10 Canadian provinces? Well, the reopening plan of schools, amongst others, we've always said it is prudent and gradual, and most particularly it has received the approval of public health. These are decisions that were approved by public health. We don't want to compromise the health of Quebecers, and we will never subordinate the health of anyone to any other interests, whether they be economic or others. So health is a priority, but we won't be able to remain confined forever, as we've often said as well. So it's a gradual plan, and I did say a word when, in my opening speech, we understand that there can be worries. There will be logistical challenges, a maximum of 15 students per class. So it requires a reorganization for schools and service centers, for parents as well. But if everybody helps out and everybody is focused towards the same objective and everybody tries to find solutions, it's probable that it won't be perfect as of the first day. As of Monday, there will probably be cases where one school is not working so well, another school has too many students. It's very probable. And it's normal because nothing can be perfect right off the bat. But I have a lot of confidence, yes. And our team trusts that if we put all the measures of public safety by creating awareness with the parents, the teachers, the students, all the people who are going to be in those environments, yes, we will succeed this operation of the gradual reopening of schools together with everybody's collaboration and most particularly in all safety for everyone else. And that is what is important. As Minister for Public Safety, what echo have you heard from the police services, knowing since we just started the deconfinement, whether the rules are being well respected, if displacements, moving around are being respected? How many fines, for example, how many tickets have been given? Well, how many fines from a daily basis, the statistics vary. In total, since the beginning of the pandemic, we are at a little over 5,000 tickets that were given in all of Quebec by all police forces. and for all sorts of reasons, whether it be gatherings that shouldn't have taken place. Sometimes it was companies that were operated who weren't supposed to be operating. So there were a certain number of tickets, and other periods where there were more. At the beginning, perhaps there were people, there was a bit of a delay before people understood that really there are bans and it can't be taken lightly. But afterward, people did mobilize themselves very well. And that's what we hear from our police forces as well. At the beginning, there was an effort that was a significant effort that had to be made for, creating awareness, dispersion. There were people who were gathered more or less. And so the police officers were trying to communicate more and create awareness more. But after that, it went very well. And yes, there will always be people who are going to show delinquency and are going to go against the laws. But generally speaking, people were very disciplined. They were very respectful of the rules, and any other synonym that you may wish to use. And exemplary, basically, since the beginning of the pandemic. So whether it be what I hear from the police forces or even my colleagues, the members of Parliament, yes, there are exceptions, but what is important is to thank Quebecers and especially tell them that it's not over and we can't stop. And perhaps that is what the challenge is right now. I would say that the beautiful weather coming up, the fact that we've been confined for many weeks and we miss our, people that we care for, there are many factors which could bring people to be tempted to want to gather, to want to go out, to perhaps want to do too much too quickly, and could bring other people to even, give in to the temptation. So please do not give in to the temptation. Tell yourself that this privation that we have right now, which is temporary, is going to give us access to more freedoms later. So it's an investment to not give in right now. It's going to, be something that is going to be fruitful later. It's very important. And also, to talk to our parents, our grandparents, our children. Our colleague, Marguerite Blais, yesterday announced easings of measures for people 70 and over who are going to also find a part of their own freedom and autonomy back. So that is probably very welcome. But so by, conceding certain realistic easings that way and by giving people a part of their freedom back, we hope that it will help so that people continue complying with the guidelines, amongst them social distancing, so that we can find a normal life as soon as possible. And a clarification for people 70 and over, because in press conferences, sometimes we're not as explicit as we should be, and there can be different interpretations. So I said yesterday that businesses were going to have, a schedule for people 70 and over. But I don't want anybody to interpret that as, a person can go to those essential services only at the moment when it's reserved for the elderly. I mean, people who are 70 and over have as much freedom as everybody else here right now to go and to those stores that are open. So I want that to be clear, because some people might interpret, that if there is, for example, a specific time, that means that they can't go at any other time. But no, that isn't what it means. The other thing as well, together with certain things that were said on the 11th of May for caregivers, that was only for people to be able to adjust themselves for the system. People can go out as of now without being accompanied if they are autonomous. It's not something that is going to start on the 11th of April. People can go out for walks as of now. We do ask them to respect social distancing, etc., the same elements, but it's not what we were targeting with the 11th of May. But if in a specific place they're ready earlier, no problem. The 11th of May was just to give people the time to adjust themselves. And therefore, in fact, there were also questions in terms of tests for the hot zones and RPAs, because a lot of people who live in those residences also have fears and concerns about, having people who go out and come back in and bring the disease back. But if ever there are tests that are required in hot zones already, it's not that necessary. If the person who comes and helps is a caregiver, has understands. But if ever there are tests that are required for people. People are not going to have to wait 3 days for an appointment. It will be done very quickly. They won't have to wait. It has to be done quickly. And in the exceptions where there might be a residence for elderly people that might be hit with an outbreak, an intensive outbreak inside, well, then the guidelines will be different. But I just wanted to specify that people can go out if they don't have to wait until the 11th of May. And we're doing everything in our power. Don't forget that for humanitarian reasons or other reasons, people do have access to their families. That has to be very clear. Thank you.
Bonjour, ma première question.
My first question is for Ms. McCann on the situation in Montreal. I understand that there are now patients from hospital centers in Montreal who are being transferred to hospital centers outside of Montreal. Is that to say that we are entering the level of alert number 4, so the last contingency phase in the plan for Montreal, and that the situation is worrisome, particularly? Well, it's clear that the Montreal situation is very different from the situation in the rest of Quebec. We've been talking a lot in the past few days about this. And what we are doing started a while back. Even a few weeks ago, we started transferring patients towards the South Shore, for example, to Charlemagne and Pierre-Boucher, and even towards the North Shore at Le Gardeur. So this is nothing new. But yes, we did add Trois-Rivières. Lately, we transferred some patients there to decrease the pressure on the island of Montreal. Because beyond the COVID-19 infected patients, which is increasing lightly, we can't say that hospitalization is increasing in a significant way in Montreal. And elsewhere in Quebec, there isn't a problem with hospitalizations for patients who have COVID-19. In Montreal, it's increasing a little, but there is pressure anyway because the other activities are starting again in Montreal, as they are elsewhere. But taking into account the situation in Montreal, there's more pressure. So people who were waiting to have care, who could wait for a month, 6 weeks, well, now we're bringing them back because we have to intervene. And the surgeries as well have started up again, and we want to increase the volume of surgeries to 50% of the potential. That is what is being done gradually as well in Montreal. So we want to remove a little bit of the pressure, and that is why we are transferring a few patients to different places, and we have been doing for a little while, the South Shore and the North Shore, but also to Trois-Rivières. So it's phase 4? Yes. Dr. Arruda, I have a question for you about the tests. Because now we are deconfining, we're telling the elderly you can go out, but we have no idea what the level of transmission is as such in the community. Because we don't have any tests that were done before the confinement. We were talking about it already last week. I want to understand, are we, in fact, to increase the number of tests? And is it, in fact, giving results so that today you have a better idea of where we're at? Well, your question is very pertinent, and the tests, that is one way of having an idea of the situation, but the investigation of contacts as well and the declaration of cases as well. It's not the same kind of information, but it is information. But particularly in the metropolitan area, we have increased, but people also have to come, and we will start inviting people to come. We have increased the number of tests, for example, around the cases that have symptoms, but now we are testing cases in the families that are not necessarily symptomatic, and we're telling people, stay at home, we're going to wait. If you have symptoms, we'll test you. Now we are testing them to be able to see whether there isn't faster transmission in family nucleus. In the region of Montreal Nord or Saint-Michel, there were screening tests that were done, and it's being organized in Laval as such. So we will have a better idea of these subsections, regionally speaking. And there's a broadening of the 6 groups for tests that was done, because there wasn't a sero-epidemiological, random study made before the deconfinement and then after, but we will have indications for the number of outbreaks and clusters that we find, and with analyses around the investigations and cases and the tests that are going to be more significant. I would also like to add I wanted to add something on the Montreal situation. Is that okay? Just to complete the answer that I gave earlier, what is also important to say is that we have patients right now that are in the Montreal hospitals and who could be elsewhere. For example, in the buffer zones. We have about 700 spots in buffer zones right now in Montreal that are places like hotels, like the Hôtel Dieu, and we do have the physical places, but we don't have the staff to be able to transfer more people who are at the hospital right now and who could go to those buffer zones. So that is an important element to mention to you because we're making, calls to people who may want to come and contribute. So on Je Contribue on that website, because we do need that staff in order to be able to care for those people who would go to buffer zones, to be able to open more of them. So that also explains the pressure that we are experiencing on the island of Montreal. So once again, we're making a call out and we are looking for other strategies to make sure that we have full-time people who will come and help us in the health and social network sector. About the test, Dr. Arruda, where are we at in terms of the objective of 14,000 by Friday? Because we have not managed to get the data. The data are being compiled, and there were test data that were made yesterday in clinics that we don't have as such, but we are at around 7,000 still. It also has to be understood that we are organizing, you saw the story with the buses. The population also has to be there, so we are going to be inviting them. There's a very specific communication plan that is going to be sent to different cultural communities in Montreal to be able to go get those people so that they show up to the screening test. Even if, we offer, people do have to come. So we plan that with that, we'll be able to get to increase and use our maximum capacity. In Ontario, on Monday, they went over 16,000 tests. They have more population, and yet every day they have only half the number of cases. In absolute numbers, Quebec is completely apart from the rest. And in Ontario, they wish to deconfine when they will be below 200 cases a day. And we are deconfining and we're at 900 cases. How do you explain that? Well, first, the cases, and I haven't made the calculation in terms of ratio. They're doing 16,000 tests, but they have a much larger population than ours. The number of cases as being an indication for deconfinement, it's a choice that can be made, but you know that the number of cases depends on the number of tests that are effectuated. So I think that the criteria that is usually recognized, and without wanting to discredit, the number of cases, but it's the number of cases in people that are being hospitalized and in ICU. Because if you screen less, well, you automatically lower the number of cases. Of course, we have phenomenon, the issue of CHSLDs here is a very important issue. And when you look at the situation outside of the metropolitan area in Montreal, the cases are really lowering, and we are below those numbers for the rest of Quebec. But there is a specific issue in Montreal. Madame Guilbault, I'd like to hear you on your dilemma of your two roles as minister responsible for the capital area, a region that goes up to Charlevoix and that has a lot to do with tourism and that would like to be able to welcome people, as well as your role for Minister of Public Safety, who says we don't want, who are saying we don't want people from Montreal to come and see us because we don't want a new contagion. How do you balance that out? Well, that's a good question. It's true. And the same dilemma exists in many places in Quebec. But yes, in the national capital area, we had only one place that was affected by confinement, only one place where there were surveillance points, and that was Charlevoix. And yes, that is a concern. Every week I talk with all the elected officials in the national capital area. We talk about all sorts of things, but about the tourist and cultural aspect as well. It's those two industries that are very affected, as we know. And my colleague, Caroline Proulx, Minister for Tourism, is working right now on a sectorial plan for the tourist area. Nathalie Roy, my colleague, is working on a plan for the cultural industry. Today we are not able to give you any date for when we present that plan or to make any announcements having to do with tourism or culture, unfortunately, because we, of course, have to go very, very gradually. And regardless of what we announce anyway, it is always only if it's been endorsed by public health. But these are fronts on which we are working. We're all very concerned, the regional ministers and the elected officials, generally speaking, by the incidents on the tourism industry. And I said last week that one day we will have an extraordinary tourist opportunity. Something will come out of this pandemic that we are experiencing. But, that'll be for later. And at the beginning of the summer, I won't keep it from you. There are many people who are talking to us. We can talk about the camping areas, the hunting and fishing, the SIPAC parks, and the people who supply them, day camps, vacation camps, and Little League baseball, is what I call it. But what I mean is the different sports for our children. So, of course, we're going to put the emphasis on individual sports. What is going to be allowed or not? When is that going to be allowed? And we're working on all those fronts. Please note that all the ministers involved, in collaboration with public health, and it's important to say so, these are not decisions that politicians can make. These are decisions that must start with a recommendation or an authorization from public health authorities, regardless of what we say and do. And I want to reassure everybody who is concerned by those sectors in particular and affected. And, in the Charlevoix region, we are very conscious of the impatience and how much people are looking forward to welcoming these announcements. We will do it when the time comes because health is still the number one factor to be taken into account. Dr. Arruda, you told us here many times that masks protect others. The homemade mask, I wish to say, or the face covering, as we like to call it now. Explain to me why yesterday in your explanations you mentioned the 70 years and over will have to wear a face covering in public places. In principle, the risks for them are higher, but are not. They don't transport the disease more than others, so I have a hard time understanding. No more than young people and no more than other grown-ups. Wearing a mask within the community right now, and I said it, or the face covering, its efficacy is not completely shown in any study. But right now, in the context where people, when they wear it, it will also be part of the respiratory etiquette. If another person of 70 could be incubating the disease and doesn't cough, the interpreter apologizes. We had a technical glitch. I missed a part of that sentence. Individual protection has not been shown. It's just what we want to avoid is just, a kind of respiratory etiquette. If you cough, you perhaps don't need to cough into your elbow. And if you wear it and wash it regularly, it's in that perspective. At the very beginning of the pandemic, I had a lot of resistance because of the fact that I didn't want people to think that, they were superheroes if they wore a mask and forgot about washing their hands, because that does remain, the guideline. The 2-meter distance is number one, and then washing your hands before you go out, when you come back, when you eat. And wearing a mask, in my opinion, is going to become something that is going to be integrated within the population, and probably when we wear the mask as well. Others who are scared of us may feel better about it. But it's true, and I'm going to recommend it as much to people who go out to take the metro and etc., particularly in the metropolitan area where people move around a lot. So, go with face coverings. Thank you. Madam Deputy Premier, on a more personal note, would you be ready to send your children to a daycare? I'm going to answer in two different parts. First, I am not in the priority services, so at any rate, I don't have access under reserve of the prioritization that will be done, because yesterday I filled the form for my own daycare in my real life. So I don't think that I'm eligible anyway in the first phase, and that's quite normal since my spouse was already on parental leave before COVID-19. So for all sorts of reasons, my daughter won't be going to daycare. But if I were in an essential job with the impossibility of working from home, and that both parents couldn't work from home, and that I was truly objectively considered as being an essential service, for example, in the health network, on the question of would I be comfortable for my daughter to go back to the daycare that she goes to, the answer is yes.
Dr. Arruda. Dr.
Arruda, on Monday, the Premier was telling us it's not a good idea that children go see their grandparents who are 60 and over. And today we understand the context, and we're having a hard time, having enough people to work in schools and daycare. And now you're announcing to us that the workers of 60 to 69 years of age can go work in environments where there are children. Is that not a contradiction? The context of reopening daycares is going to be within a context where people have personal protective equipment. People will be wearing masks. As such, in daycare centers, there will be measures for social distancing, etc. And, we're talking about people who are healthy. If people have, specific diseases or illnesses, that's not the same thing. And now I would also like for people to understand that people can't now think that, well, why is it that now grandmother can't babysit their grandchildren if she's 67? It's not the same context of affiliation that will be done in a relationship between a grandparent and a grandchild. It's not the same kind of relationship. And I don't mean by that when in a daycare, the people don't have a good relationship with their children, but it's not their grandchildren, so it's not the kind of exposure. And don't forget, it's really with masks that people will be working in that context. And if they have health problems, they won't be going. Madam Deputy Premier, Dr. Arruda, Madam Minister, would it be possible to know, Ms. McCann, how many patients have been transferred? You said earlier on that there were transfers that were made towards the South Shore, for example, in Trois-Rivières. Would it be possible to have the specific data? How many patients and how many beds were freed up? Well, I don't have the specific data today, but we could get back to you with it at the next press conference or send you that information. There's no problem. We will be sending you that number, the number of patients that were transferred. I don't have the exact numbers. I'm not going to, try to guess. As a follow-up question, all sorts of people, Dr. Arruda, have been writing to me to ask me why our golf courses, I know that you talked about a little bit, Madam Deputy Premier, earlier, but why are golf courses not open? Or why aren't we already announcing, the fishing activities? Because these are sectors that are outside where it's pretty easy to keep a certain social distancing. Golf course is big. Fishing, in Quebec, there's 1 million lakes thereabouts. Are you going to allow golf courses to open and people to go there? The analyses are ongoing and it should be announced soon. Could you be more specific? No, I can't tell you. I would love to tell you. I'd love to give you a date, but, in the sequence of things that we have to do, it's ongoing right now in terms of being analyzed. You'll understand that the different principles that we use are the same. That is to say that these are not collective sports. These are going to be elements with a greater possibility of social distancing outside and not inside. So it should happen in a logical sequence. But I can't tell you the date. It'll be announced in the following weeks. We're conscious that summer is coming and that we have to be realistic as well. So there will be announcements as soon as it's possible. Two last questions in French. First question to the Deputy Premier. So the number of cases of COVID-19 has doubled at the Bordeaux prison as of last week. You were referring to it in your introduction. How can you convince the Union for Correctional Agents and the League for Rights and Freedoms and the families of the inmates that the crisis in CHSLDs will not be repeated in that prison? As an answer, and I did talk about it at the beginning of the press conference, there's already many preventive measures that have been set up in our detention establishments in Quebec in collaboration with public health. So visits were interrupted and have been since, as I recall, the 14th of March. So the comings and goings are limited. The new detainees coming into the establishments are isolated. The people who show symptoms or who test positive as well are either transferred as needed to hospitals or are placed in isolation. So there's a lot of, conferences that are done at distance, the visiting room through the screen. So many measures were set up, so which means that, we did have very few cases in the establishments. But in fact, there were certain cases. We're now at 34 detainees who tested positive as of today in the Montreal facilities, which means that I announced that we're going to have further measures. Public Health, in fact, is recommending to go with that further measure of allowing people to leave for medical purposes, which will allow us to reduce by a certain amount the population of inmates, with the objective being the protection and the security of the workers who work there in the correctional services. So that series of measures, we hope, is going to ensure a work climate that is safer for our staff and, of course, to the detainees. And of the 14,000 tests that you targeted in order to be able to detect COVID-19 in Quebec, how many are being reserved for the inmates and the inmate population? I don't have that data. However, we can check. It depends. Well, there isn't a quantity that has been reserved. It will be an investigation, just like any other outbreak area. So people who are tested, who have symptoms at the Bordeaux prison, or the significant contacts will also be investigated in the same way.
Merci. So time now for questions.
English questions now.
Today with Phil Autier, Montreal Gazette.
Good day. Just wanted to ask you, Dr. Arruda, BC's public health director has said that catching the virus outside is highly unlikely. I believe you said that as well at various points. Given that people want to get outside and exercise more now that the weather is nice, would you advise them to should they be wearing masks if they're outside hiking, jogging, walking? Since this seems to be a subject of debate now that the weather's getting nice.
In fact, I would say if they can tolerate it, it's a thing because, when you use a mask, when it's a very tight mask, the oxygen and the flow can be lower. So I think if they can tolerate it, especially not for protecting them, but also, but if they can keep the 2 meters away from other person, that's not absolutely necessary. But people could be walking. It can be sneezing, crossing somebody. There is, the probability is low compared to close contact, and we knew that we have to have a more intensive. So I would say it could be recommended, but not necessarily, because especially if it has an impact on your performance with walking because of the oxygen.
The other question for Dr. Arruda and for Madame Guilbault is you just mentioned that teachers between the ages of 60 and 69 can safely work. But the Premier has said himself that there is a risk for people over 60. Can you explain to us what is the change in your position? What is the change in the risk factors for 60 to 69-year-olds? Because it's clear you're shifting what has been said a few days ago.
I may go?
Well, we said that.
Allez-y, monsieur.
Yeah, we said, and that's why we wanted to make the clarification today, because we understand that some people in the age between over 60 might have some worries or might have some questions regarding their return to work. So we found it important to make this clarification today that the risk of having complications is over 70. But of course, people between 60 and 70 are more at risk than people under 60. But if they comply with the directives of the National Health in going back to work, we said that they can go back to work without being too worried. But they have to comply to the directive. This is very important, and that's why we ask all employers in the province to take that into account too, and to make sure that people between 60 and 70, but all people at any age, are able to respect the rules of distancing, the rules of washing hands, and everything that we have to comply with.
But if they have, I would say, chronic disease or something else, that's not the same case. It's only for the, I would say, the good health person between, because the risk is very going up at 17. And the risk is always there. Even a young person of 35 years old can have the disease, but the level where it goes up is really 70. And it was we used before, but there is some people from 60, and sometimes people from 60 to 70 have those other diseases like diabetes or hypertension. So there is a mix of conditions, and I would say the age. But by the age, it's by 70 it goes very up.
Thank you. Samuel Pouliot, CTV News.
There's still confusion about whether caregivers will be able to visit family members in the seniors' residences. What protocols will caregivers have to follow so they can visit residences? Will they be tested, and will they be allowed inside if there's confirmed cases inside the residence?
Yes, I want to give you a first answer, and Dr. Arruda will probably complete with the details of the protocol. But I want to make it clear, like Madame Blais made it clear yesterday, that people will be allowed to go in. All the organizations where a caregiver wants to go and take care of a member of his or her family. So this is the first principle. If, for whatever reason, an organization is refusing, they will have to contact the ministry, the organization, and present the dossier quickly, and we will intervene at the ministry level. So the justification has to come from the organization. So the basic principle is that all caregivers, the real caregivers that were there before, that were really involved systematically with a member of their family, can go in. And if there is a reason, a refusal, the ministry will get involved. So that's basically what's going to happen. Now, I know there was question about being tested. The caregiver will have to be tested if the caregiver is going into a cold zone, meaning a place where there are no cases of COVID-19. Otherwise, if the caregiver goes into a place where there are cases of COVID-19, there's not a necessity to be tested. So that's, I don't know if that answers or if Dr. Arruda wants to complete.
Thank you. It's clear for you. It's clear for me.
Good question. And there are reports that Montreal hospitals are overwhelmed and transferring patients as far away as Trois-Rivières. How is this possible, and is there a risk for the health of other regions?
No, I think for other regions, all the precautions are taken. There are no risk. The people are in the hospital, and it's very, very. There are prevention measures of prevention of transmission of infections. What's happening in Montreal briefly is that we have a situation where there are some patients in the hospitals right now, COVID-19 patients, who don't require necessarily to be in the hospital, and other patients also that have other physical problems that could go out of the hospital. One of the ways to have people come out of the hospital is to have those zone tampons. These are places where people go before they go back home or before they go back in the milieu de vie. And we call them the zone tampon, and there are hotels or Hôtel Dieu, and we have the physical facilities, but we require more staff to take care of the people that would come out of the hospital temporarily in those zone tampons. So those people, they stay longer in the hospital, and on top of that, we are also having more activity, because some people who have no COVID-19, they require care now more because they've waited for a month or 6 weeks. And we're starting again more surgeries. We're getting to 50% capacity. So this creates a pressure in Montreal, so we want to relieve the pressure by transferring some patients.
Thank you. Quickly, Kate Sunny, CBC News.
Good afternoon. We're hearing that healthcare workers are being redeployed, getting sick, then moving back into their old jobs and infecting CHSLDs that previously had no cases. How is this possible, and don't you think this strategy is just making things worse?
Now, there are really steps to be taken when a worker is infected and goes home to recover. There's a 14 days period. The person also has to be tested. They require 2 tests to go back to work. So this should be the norm for people to go back to work. There are situations, because we are in a context where we lack staff, we have a lot of people who are away for different reasons, where a person, a worker who has recovered, could go back in a hot zone, meaning a place where there are COVID-19 cases. So there's no risk of, transmission. But otherwise, and the other point is, otherwise it's not possible. But what we want to stress is that what we need are people, full-time people, teams that are the same teams going to the same residence, the same CHSLD, day out, day in. That's what we're building now, and it's done in many places, but there are still places where we require more staff to do that. But what we're telling the organizations is that this is the basic principle to really stop this propagation, that people stay in the same team, in the same organizations when they give services. So we're implementing this everywhere, and we want the organizations to follow this principle very strictly.
Yeah. I was speaking with a person yesterday. She told me that she went through a crisis because of anxiety. And now you're announcing an action plan of $31 million to help people. First of all, it's going to be a challenge to find the mental health professionals. And then don't you think that Quebec's lockdown was too harsh on citizens?
I want to answer about the 31 million because I want to give more specific elements to really put forward the point that we're going to do it. It's a very, very important plan, and we're going to hire 300 people, more people, équivalent temps plein, full-time people, and we're going to go get them in the private sector. You are aware that the psychologists, for instance, a lot of them in the private sector have risen their hand to help out. We're going to go and work with them. We're going to buy services from those psychologists. But there are other people also, other professionals that are in the private sector. I'm pretty sure we're going to be able to find 300 of them to help us. So that's our plan. We want to reach everybody. We want to tell people you call Infosocial, the 811 number, which is different, Infosocial from InfoSanté. You call there. There are 3 minutes wait at this point. Or you call your CLSC, and we will direct you either to psychosocial services, either to mental health services, depending on your needs. So we're very confident that we will be able to provide those services to our population.
Thank you. We're already out of time, so quickly, if you want to add something.
Just a case, I think it's always a balancing. At the beginning, we had to save lives, and we did it, and we didn't, and we flattened the curve. But at the same time, we get problems with the CHSLDs and everything. And now we're trying to open, make it less strong. And you see the reaction of some who says that we are going too fast. So it's always, I would say, a difficult situation. But I think it's almost impossible to have not health impacts when you do confinement. It's clear. But I think we must try to find solutions to help. And it's why we don't want the elderlies lose their autonomy and everything. We are going back a little bit, but it's always a balance things. So I don't think we were too much. I think we were right at that time, and now it's time probably to take some good brief and help those ones who are going to have the impact of this.
Thank you. So now 2 last questions from Raquel Fletcher, Global News. The first one is for Minister McCann. What are you doing to get the 11,500 people missing from the health network to come back to work? Because you have already increased wages for elderlies and provided bonuses. People still do not want to work full-time in long-term care homes. Will you be able to fill these vacant positions when, and how much will you actually have to pay people in order to fill those positions?
Yes, we're working very hard on that. What I want to say also on the 11,000, there's a part of them that are people that are away from work for health reasons. For instance, pregnant women, people who are immunosupprimés, and people who are 70 years old and over. So this is a part of the 11,000. There's another part of people who are waiting for tests, and again, as we were saying, we want those tests, those results to come in very quickly. And there is another part of people who are away for an illness other than COVID-19, and another part who are away because they've been infected. So, and we want to follow up very systematically on people who have been infected, but after 14 days could come back. Some might be afraid. We want to reassure them. We want to give them all the protective equipment also to come back. And also we're working on a strategy, a stronger strategy even, to really get people to come in or to increase the time at work, because we have still a lot of people who are part-time. So we're looking at a strategy to an incentive for people to work full-time for at least a full month. So we have really consolidated the teams and we attract people at work.
Thank you. And as a very last question, maybe for Dr. Arruda, will the minister, will the ministry consider including race, ethnicity, and economic status in the data you collect from people infected with COVID-19? Community groups and some politicians say having that data is vital in getting a proper understanding of the high infection rates in places like Montreal North and Côte-des-Neiges and DG. Toronto started collecting race-based data in April.
Yes, this information will be collected. I must check back the exact questions that is placed, but we are collecting this information because especially if there is also risk factors that from certain communities that could be related to genetics and other kinds of approach.
Thank you very much. Donc, c'est tout le temps que nous avions.
So that's all the time that we had. Thank you for your availability and see you soon.